Hello and welcome friends, myself Salma Gandhi here to help you for the PSM subject. So our today's topic is tuberculosis. First we'll see the introduction. Tuberculosis is also known as the Koch disease. It is a specific granulomatous infectious disease which is caused by the Mycobacterium tuberculei. It primarily affects the lungs, causing pulmonary tuberculosis, and it also affects the meninges, intestine, bones, joints, skin, and the lymph glands and other tissues of the body. It is a chronic disease with varying clinical manifestations. There is a bovine tuberculosis which affects the animals like cattle. Tuberculosis is a worldwide public health problem. Due to effective drugs and vaccines, it is preventable and curable. Since 1993, India has implemented revised National Tuberculosis Control Program using the DOT strategy. That is direct observed short course treatment strategy. However, due to increase in the HIV prevalence, there is serious threat in control of the tuberculosis. Now the World Tuberculosis Day is celebrated on 24th of March. So this was the introduction. Let us move further with the epidemiological determinants. First one is the agent factor. The agent is Mycobacterium tuberculei. Now there is 4 species, out of which the hominis is the human strain. The Mycobacterium tuberculei is a aerobic, slender, rod-shaped bacilli, and it is also acid-fast bacilli. It is a facultative intracellular pathogen which infect the mononuclear phagocytes. Then comes the source of infection. There are 2 sources. One is the human source, where the cases whose sputum is positive for the tubercle bacilli, and also the cases who are maltreated or who have not received treatment. They are the source of infection. Then comes the bovine source. It is by the infected milk. So these are the 2 sources of tuberculosis. Further comes the infective material. It is by the nasopharyngeal secretions, mostly by coughing. Then there is a period of infectivity. The period of infectivity remains till the patient is untreated, because once the treatment is taken, the infectivity is reduced by 90% within 48 hours. So this was regarding the agent factor. Further moving with the host factor. This disease specifically affects all age groups, and males are more likely to get affected. Nutrition in HIV predisposes to tuberculosis. The immunity. There is no inherited immunity is found, but it is acquired by natural infection or by the BCG vaccination. Moving further with the environmental factors, in that this disease is mostly seen during winter or the spring season. Then comes the incubation period. It is 3 to 6 weeks. Now, development of disease depends on the closeness of the contact, extent of the disease, sputum positivity of the source case, and host parasite relationship. After the incubation period, there is mode of transmission. So it is transmitted by inhalation of the respiratory droplet, which is generated by the sputum positive of the tuberculosis patient. Then comes the portal of entry. It is by respiratory route and non-respiratory route. Respiratory route by inhalation of respiratory droplet infection, and non-respiratory route by intake of the contaminated milk, also by metastasis. Now, in tuberculosis, there is a social factor. As it is a social disease, there are certain factors due to which the tuberculosis likely to occur, which includes poor quality of the life, poor housing, overcrowding, population explosion, malnutrition, large family size, early marriages, etc. So that's it for today. Further we'll see in the next class.